With test kits from China and South Korea having arrived and being put in place, the number of coronavirus positive individuals took a huge leap, with 84 recorded cases, upping the total number to now 636. PTV correspondent Mark Vitalco rounds out the other stats on deaths and recoveries in this report.
For 3 consecutive days, the Philippines recorded another big increase in the number of COVID-19 cases, bringing the total to 636. 3 more infected patients have died, while 6 recoveries were recorded, bringing the total number to 26. This is the highest number of new recoveries the Philippines recorded in the day so far. All the 6 recoveries are among the first 100 Filipinos who contracted the virus here in the country. 2 of them have 1 negative result, while 4 have 2 negative results each. Based on the new guidelines of the DOH, COVID patients who have clinically recovered may be discharged from the hospital and advised monitored self-isolation for 14 days. A repeat test shall be conducted after the said 14-day home quarantine. Health Undersecretary Maria Rosario Vergere said that these new guidelines will further improve the turnaround time in hospitals. Aside from the 3 COVID referral hospitals in NCR, the DOH is also preparing a possible community quarantine facility where those persons suspected of having COVID-19 or even those who were infected but asymptomatic or with mild symptoms only will be isolated. This is one of the contingency measures of the agency for possible surge of patients, as well as to solve the congestion in some hospitals. Yusek Vergere explained the ideal requirements for an isolation facility for persons under monitoring or patients under investigation.
Ang isang isolation unit po ay kailangang closed door na may tamang ventilasyon. Maari pong isang permanente o temporary structured tulad ng gymnasium, simbahan, hotel o iba pang establishment. Ang iba po gumagamit po ng tents katulad po sa ibang local government units.
So far, the DOH is considering to partner with the Quezon Institute and the Philippine Red Cross to be the country's first community quarantine facilities. Meanwhile, the DOH reiterates support for the healthcare workers fighting against COVID-19. It urged private hospitals to provide adequate compensation to health workers and to limit their shift to 6 to 8 hours for them to have ample time to rest. With the Bayanihan Act, the procurement of medical supplies for their protection will be expedited.
Sa ngayon po ay on process po ang ating mga procurement ng ating mga equipments at medical supplies gamit po ang budget ng DOH. Opo, dahil po dito sa ating Bayanihan Act, makakatulong po ito para mapabilis po natin ang procurement dito po sa ating gobyerno.
Yusek Vergere also asked the public to show support to healthcare workers wearing a red armband. Meanwhile, the Department of Foreign Affairs says the number of overseas Filipinos who have been infected by COVID-19 rose to 169. 77 of them are undergoing treatment, while 90 have recovered. Unfortunately, 2 Filipinos abroad have died because of COVID-19. So far, there are 25 countries or regions with Filipino COVID-19 cases. Mark Fetalco for The Nation.